What are the enemies of batteries?
Some of them would be like, you got to be careful with batteries. Kids may get the batteries. You don't want them to digest those.
No.
Pets.
Yeah.
Pets are notorious for getting after hearing aids, so definitely be careful with those batteries.
I love the smell of your ears.
They do.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
We have a brand new episode of Ask an Audiologist for you to feast on this week just before Easter Sunday. I am Kevin Ziener.
I'm Dr. Jordan.
Today we will be discussing hearing aids and how to extend their battery life. The topic was given to us by Dr. Dusty Jessen of Columbine Hearing Care in Columbine, Colorado. So, Dr. Jordan, let me kick this conversation off by asking you first. How long should a hearing aid battery last?
So there's a lot of answers to that.
Okay.
So that is not a short answer.
Perfect. We got 9 more minutes.
It depends on the type of hearing aid that it is. Does it have Bluetooth or not? How much battery consumption is it using?
Okay.
Along with how severe is your hearing loss to where that hearing aid needs to be producing more power.
Got it.
So you've got different batteries, right?
Mm-hmm.
You got zinc air batteries, which basically just means disposable batteries.
Okay.
That comes in a couple different sizes.
Quick quiz. I've done this before, and it worked last time, and if it's not broke, don't fix it. Can you name the colors and sizes?
Of course I can.
Yes. All right. Dr. Jordan, you have, without it actually being timed, 30 seconds to give us the 4 colors and sizes of batteries. Go.
Okay. So you have a size 10, which is yellow. It's the smallest.
Spot on.
You've got a 312 battery, which is a brown battery.
Spot on.
And then you have a 675, which is blue.
Yep. One
and
more.
A size 13, which is orange.
Oh my, that's like 10 seconds.
There you go.
I mean, I have this little sounder right here. Amazing. Absolutely amazing. 4 for 4. Lights out.
There you go.
Yellow, orange, brown, blue. Now, can you tell me why they're those colors?
No.
Okay. I actually don't know
idea.
That would have been bonus points.
Yeah, I have no idea.
That would have
They
been
didn't teach
the
you that
final
in
round.
school.
Okay, good. Fair enough. All right, back to the actual. Done playing games, Kevin. Back to the actual battery life. So obviously there's 4 different size batteries. They are meant for clearly very different hearing aids. I'll let you digress. Do you want to get into the different sizes, what they mean, what they do, how long they last, or you just want to pick right back up where you left off?
No, that's fine. So we can talk about those 4 different ones first.
Yeah.
So a size 10 being the smallest is for your super tiny hearing aids that go typically like down into the ear canal.
Okay.
It needs to go in a smaller spot, so it needs to be a smaller battery.
Makes sense.
However, that means that you're not going to get as long of a battery life because it's a smaller battery.
Sure.
So those batteries, I mean, typically 2 to 4 days.
Got it.
Depending on
it's quick.
Yeah, it's pretty quick on those. Size 312 is the next size up. 312, you're probably going to get around, I say 5 to 7 days. Any of these, give or take. It depends on, again, if they're Bluetooth, if you're using a lot of Bluetooth battery consumption, it's going to take a lot more of that battery. So it may be closer to 3 days.
Okay.
Same thing, if your hearing loss is a greater hearing loss, that hearing aid's got to produce more power, then it's going to suck up that battery consumption too.
Makes sense.
So the next one's a size 13 battery, probably looking closer to like 7 to 10 days.
Okay.
And then a 675. Those are for more powerful hearing aids. So some of them, it's still close to about 10 days, give or take. But because it's a more powerful battery, those are typically used for like severe to profound hearing losses.
Sure.
So it is using more battery consumption.
So I don't know that we've talked about this before, but tell me why somebody would want a hearing aid that requires batteries as opposed to a rechargeable hearing aid.
Yeah, that's a good point. So, on the flip side of that, you've got rechargeable batteries, and those batteries are internal inside the hearing aid, so they typically don't come out.
Sure.
Now, there are some that we can replace in the field in the clinic, but not batteries that the patient would replace at home.
Got it.
So those rechargeable batteries are typically like a single, you got to charge them every night.
Yeah.
So for patients who are, say for instance, like some of the patients that may choose a disposable battery versus a rechargeable would be like surgeons who their work, they may have a 24-hour day.
Got it.
And they don't have time to charge their hearing aids.
So I don't know that we've talked about this before, but tell me why somebody would want a hearing aid that requires batteries as opposed to a rechargeable hearing aid.
Yeah, that's a good point. So, on the flip side of that, you've got rechargeable batteries, and those batteries are internal inside the hearing aid, so they typically don't come out.
Sure.
Now, there are some that we can replace in the field in the clinic, but not batteries that the patient would replace at home.
Got it.
So those rechargeable batteries are typically like a single, you got to charge them every night.
Yeah.
So for patients who are, say for instance, like some of the patients that may choose a disposable battery versus a rechargeable. So things like that. I have patients who work like offshore who don't have access to recharging
like electrical outlets.
Right.
Got it.
Or some of our patients where I'm from, we have a lot of hurricanes. You got to worry about power outages.
Yeah.
So some of those things can kind of factor in.
So like lifestyle, profession, and really just like circumstantial living.
Right.
Got it.
Right. I will say most of our patients have started to route toward rechargeable because there's so many different options.
Sure.
You can plug it in the car if you needed to. There's also the like power banks that they can charge them, with that. So some of those things have been kind of rectified with those.
Yeah.
But some patients still prefer disposable batteries.
I completely understand it, especially in my millennial brain. If it doesn't plug into the wall, why would I want it? Right? So the idea of having to manually change batteries sounds bizarre to me, but every environment you just explained as to why you would need it, like that. Now I get it.
Right. There's also dexterity issues.
Totally.
So for a lot of our patients, they have bad manual dexterity where they can't pull that battery out or take the tab off of the battery, those types of things. There's also the cost factor of replacing those batteries and having to pay for those batteries ongoing versus rechargeable batteries.
Yeah.
And they're going to last you typically at least the lifetime of the warranty.
Sure. So what are the enemies of batteries? What are the things that you tell your patients? These are the non-starters. We don't ever do this stuff with these batteries.
Some of them would be like, you got to be careful with batteries. Kids may get the batteries. You don't want them to digest those.
No.
Pets.
Yep.
Pets are notorious for getting after hearing aids. So definitely be careful with those batteries.
They love the smell of your ears.
They do. So you got to be careful with that. What else?
No water, I imagine.
Right. Yeah. So with disposable batteries, that's one more opening in the hearing aid for moisture to get inside of the hearing aid. So if you're somebody who does tend to have more moisture problems with hearing aids, we definitely recommend going toward rechargeable because it's less likely for moisture to get inside the hearing aid and wreak havoc.
Yeah. And I imagine on the flip side, you don't want it to be hyper cold. You don't want it to be super hot, which you living in Louisiana, good luck with the super hot humidity part of it, right?
Right.
Because those are safety hazards first and foremost. Like the cold will just kill the battery. The heat can turn the battery into a little like explosive, I imagine.
Right.
So then how do we extend battery life? How do we maximize the time that we get to use those batteries so we're not going back to the store, every other day? Yeah.
So opening the battery door on the hearing aids whenever you're not using them or not wearing them, that's first and foremost. It's to me the biggest thing because that's basically turning the hearing aid off and it's not using that battery life. Yeah. So just opening, and you don't even have to open it completely. Just crack it open a little bit to where it'll just shut the hearing aid off.
Sure. That makes sense.
That's going to be one of the best ways. Making sure not to pull the battery tab off of the battery until you're ready to use it.
Still feels like black magic to me that you have to pull the tab off of the battery for the oxygen to somehow morph with the zinc.
Yeah.
And then that sorcery then brings the battery to life, turns the battery into a real boy.
Yeah, that seems like magic to me too. But you definitely don't pull that off until you're ready to use that battery. Yeah.
I mean, I don't have any more questions besides please explain to me the chemistry of oxygen and zinc, but I don't think that was something you covered in your
I don't think
AED.
I have that answer.
Yeah, that checks out, and you shouldn't. It would be weird if you did. And because, we have officially ridiculed Dr. Jordan enough with the quizzes and why she doesn't know about
Game
oxygen
show.
mixing with zinc, that is going to end this episode of Ask an Audiologist. But to continue your audiology education, please visit askanaudiologist.com. Dr. Jordan, I'm sorry to have sprung that pop quiz, but you did a valiant effort.
There we go. My professors would be proud.
Absolutely. We're sending this to her because
great.
Dr. Jordan's AUD is still outstanding. She needed to pass this hearing aid battery pop quiz, and she nailed it.
Nailed it.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
People assume hearing aids restore their hearing.
Oh, good point.
And that's not the case.
No, April Fools.
Yeah, big time.
Yeah, doesn't work like that. So I do get this question an awful lot. I don't know what our time limit is
We
here.
got 2 minutes.
We could go like 9 years on this
sure.
topic. In fact, I have.
Made a nice profession
coming
out of
up
it and
on
everything.
10.
Yeah.
Boom.